Grenada's latest COVID-19 case is a male over 60 years. He is asymptomatic and, according to health officials, is doing well. He arrived on a flight from the USA last Wednesday and is currently in quarantine. Acting Chief Medical Officer Sean Charles explains that the individual presented a negative PCR test before taking the flight, but may have been infected after and just before traveling. Meanwhile, Minister of Health Nickolas Steele says the test results of the other passengers are negative.
All of these individuals had negative PCR tests before they boarded the flight. Keeping in quarantine allows us to safeguard the population of Grenada from what we know, which is that the virus does have an incubation period, that a PCR test is a snapshot at that point in time, and that between then, the person could have been infected, and then the virus begins to increase its viral load in the body, or the person could have interacted with someone after that test and then become infected. So that is why we insist on maintaining, especially for red zone countries, maintaining that quarantine period.
Minister Steele says the new case shows the importance of following the established protocols.
This this case and the timing of it justifies that, but the maintaining of the various safety measures and protocols, because we can never be too cautious. We don't want to create too many restrictions, but we don't want to do, as we're seeing with other countries where they've reopened too much or too quickly or so, and have to close back. I would prefer that, and really it is our desire that as we open, we stay open. And that's why we must do it cautiously with the various regulations. That's why, unfortunately, as I said in Parliament yesterday, unfortunately, we cannot have Carnival as we know it this year.
The 24th case comes after 6 weeks of Grenada being COVID-19 free. For GBN News, I am Rina Pear reporting.